So most doctors don't fail or don't meet their goals with ultrasound because they lack intelligence or motivation. They're falling short because they're trying to piecemeal their education one weekend course at a time. Maybe a YouTube video here and a random, workshop 6 months later. That approach is going to guarantee you one thing. You're going to spend money and time, but you're not going to gain competency. AMSKU was built to solve that exact problem. We're a high-touch, high-standard, start-to-finish residency program designed to take clinicians from curious about ultrasound to being board-ready level RMSK doctors. Whether or not you choose to sit for the exam is up to you. We're going to prepare you the same way because mastery is mastery. There's no shortcut version. We get a number of objections, and I'm going to go through just a handful of them here today. And so one of them is, I don't have time. Really, it's you don't have time not to learn. Most clinicians, most doctors, you're going to spend years dabbling, guessing, hoping that you're eventually going to, get it. But meanwhile, you're losing revenue, missing diagnosis, watching competitors adopt it faster than you, okay? AMSKU flips the timeline. We train doctors to be the most competent in the three most clinically and financially impactful regions, the shoulder, hip, and the knee in your first 3 months. That means you're not waiting until the end of the program to use your skills. You're using them while you train. You're generating revenue while you're trained. You're building confidence while you train. Time stops becoming an obstacle and starts becoming an asset when you compound it the right way. So the second objection we get is it's expensive, okay? But the real expense is staying where you are. Weekend courses feel cheap until you realize you need 5 of them, plus travel, plus time off, plus the fact that you still can't scan confidently on Monday. That's the hidden cost nobody talks about, okay? AMSKU is the opposite of the dabble and hope model, okay? Our goal is to give you complete diagnostic framework, RMSK level preparation, and registry review coursework containing over 400 practice questions across all the learning domains. We're going through the shoulder, hip, and knee diagnostics plus injection protocols in those first 3 months. Mentorship and feedback and accountability systems. Okay, this is something we want you to monetize. Okay, it's a path to mastery, not mediocrity. Most doctors are recouping their investments before they even finish the program because they're already performing the most common orthobiologic adjacent procedures. The question isn't can I afford this, but how much am I losing every month I delay? Objection number 3 is, can I just take a weekend course? The answer is yes. That's great for exposure, but they're terrible for competency. Okay, they show you what's possible. Okay, AMSKU shows you how to do it. Weekend courses give you information. AMSKU gives you transformation. Weekend courses, you're going to leave with your certificates and some new friends, and AMSKU is going to give you a skill set that pays you for the rest of your life. If you want to dabble, take a weekend course. If you want to practice at a high level, you need a residency-style progression with accountability systems. Objection number 4 is, I'm not sure I want to take the RMSK. Well, perfect, you don't have to, okay? But you do want the skill set of somebody who could. And that's why we train every doctor to be board ready standard, because that's what produces real world competency. Whether you sit for the exam is your choice, okay? But at the end of the day, the market is going to react and reward the physicians who can scan with precision, diagnose confidently, and perform guided procedures safely. That's what we build. The biggest financial mistake doctors make is waiting. Every month you wait, every month you delay, you're missing revenue generating opportunities, cash pay injection orthobiologic opportunities. You're losing patients to doctors who can scam. You're losing confidence in your own clinical decision making, and you're losing momentum. AMSKU isn't an expense. It's a revenue producing skill that pays you back while you're still learning. And of course, beyond that, okay? The real question is, do you want to piecemeal your education or do you want to master it once and for all? Choice is yours.